Good day, everyone, and welcome to the WIDS Trinidad and Tobago Spotlight Talk Series for 2026. I am Dr. Leticia Addison, the WIDS TT for short ambassador. Today, we have a really wonderful presentation based on moving beyond risk scores with Agentic AI for Caribbean health. And our Spotlight Talk speaker will be Miss Tamika Ramkissoon. But before we get into that, for those of you who are not familiar with WIDS TT, let me first give you a quick introduction into who we are. Women in Data Science Trinidad and Tobago is part of a global organization which builds data literacy for all. We empower girls and women to lead and thrive in data science and all related fields. And in terms of our events, we host a number of independent events which allow data literacy and data science literacy at every level. And our events are open to all data enthusiasts who want to use data science, AI, machine learning, and all related aspects to be able to continue professional development and also careers in the field. And if you would like to find out more about what we do, feel free to go to widstt.com for more information. So without further ado, we would like to meet our speaker today, Ms. Tamika Ramkissoon. She's a senior product manager and AI engineer at Effect Limited in Trinidad and Tobago. And she is also one of the newest WIDS TT mentors on our team. So Tamika is going to give us a short presentation on this work that she has done, and then we will have a short chat with her about her background after. So without further ado, I will give Tamika the floor to share her screen and to give her presentation. Tamika, the floor is yours.
Awesome. Thank you, Dr. Addison and the WITS team for having me. Hi, everyone. I'm Tamika, and if I had to define my North Star, it's at the intersection of leadership, data, and emerging technology. So, as a product manager and AI engineer, my career has been defined by a single question: how can I use technology to make an impact on the people around me and by extension, the world? So I've spent years building products in healthcare and education technology. And from that, I've seen that technology can truly be a strategic tool when it moves beyond being informative and becomes a catalyst for meaningful outcomes. And that is what brings me to the work I'm sharing today. Today, we're going to move beyond the risk score and static predictions and towards an agentic AI system. So, EquiHeart is a transparent and actionable AI cardiologist designed specifically for the Caribbean. So, the system goal is to predict the likelihood of a cardiovascular disease, explain the underlying causes, and provide preventative care through personalized recommendation to, of course, support decision makings for healthcare professionals. So, we have a lot to cover today. So first, we'll be going through the context of healthcare in the Caribbean, then the technical core. We'll discuss why I chose an agentic model, how we handle data integrity, and we look at the API architecture. Then I'll introduce you to the 7 specialized agents behind the system, the results that I got, strategies for the future, and of course, we'll close with a short Q&A. So when we talk about the Caribbean, we often focus on our beautiful culture and resilience, but there's a silent crisis reshaping our families. And that's the Caribbean heart health crisis. In our region, that isn't just a medical issue, it's a systemic emergency. So when you look at the statistic, cardiovascular is number one cause for death, and this silent killer is a literal reality for 1 in 3 adults living with hypertension, many of whom don't even know that they're at risk. So this carry a massive economic impact, draining up to 8% of our regional GDP. But the statistic that hit me the hardest or caught my attention the most is the years of lives lost per individual. Most individuals die before they reach age 70. So we have the highest rate of premature deaths in the Americas. And I've seen the weight of this number firsthand, unfortunately, having to watch friends and family battle with the sudden life-altering effects of a cardiovascular disease. So for me, these aren't just data points. These are our parents, children, and the pillars of our community whose lives are often being cut short. So right now, the reality for many in the Caribbean is a cycle of waiting. The patient might wait months for a screening, and even after that, they're often left in a state of limbo where they don't get immediate mitigation strategies, or sometimes they have to wait really long to get the results of a test that they took. So traditional screening models don't help much here either because they may give a healthcare provider a risk level in a percentage or a decimal, and they don't really explain the causes for that CVD or offer a path for immediate preventative care. So our solution, EquiHeart, changes exactly that. So we're using the sharp and counterfactuals, and the system uses that to identify the specific drivers behind the risk that it detects. So the orchestrator that I'll be going through in a bit then intelligently dispatches that context to the relevant specialized agents for a curated and personalized recommendation for whatever CVD risk factors they may have. So instead of a patient waiting months for a follow-up, we are providing a transparent, actionable roadmap the moment the data is received and processed, thereby, of course, turning a static prediction into an immediate clinical strategy. So, firstly, our data foundation, we're utilizing the Kaggle CVD dataset. This dataset represents 70,000 patient screening and focuses on 14 features or characteristics. So they range from blood pressure and cholesterol all the way to lifestyle habits, right? And integrity starts at the ingestion layer. So we perform a lot of pre-processing and handling of categorical mapping. We implemented outlier removals for physiologically impossible blood pressure readings, ensuring our real-time inference always matches a reliable training distribution, right? And to keep the system fast and efficient, we use the L1 regularized logistic regression for feature selection. So by identifying the most predictive markers, we're allowing our orchestrator to work with a lean, high-impact feature set. This doesn't just improve speed, it also enhances the reliability of our sharp explainability that I'll go through in a bit. And as we all know that in a clinical setting, every second counts. So we need speed and we need reliability. But we didn't stop at standard metrics. We audited this model for gender bias using demographic parity and equal opportunity difference. So to summarize all of that, we are prioritizing clinical integrity and fairness over raw numbers. So we're ensuring that our AI cardiologists can perform equally and equitably for every patient. So now our API workflow has four main pillars, and these are the caller, the orchestrator, the model and the agents, and of course the API response. And the beauty of this system is that it is model agnostic to the caller. And then the orchestrator handles alignment out of distribution detection, and of course the agents are dispatched internally. So to really understand how this works, I'm going to focus on two of the four pillars. These are the orchestrator and then the model and agents. All right, so at the heart of the system is the orchestrator class, and it starts on the left with the caller. So whether that's in a EHR system or a mobile app, the client simply sends a data dictionary, which is the patient profile, containing their primary health markers, things like blood pressure, cholesterol levels, and age. And from that moment, the orchestrator takes full control, right? So it executes the precise six-step workflow to handle that pre-processing and validation. So you see that in the orchestrator agent class on the screen. So at step one, we have validate and align. Here we ensure that the input perfectly matches our saved schema or patient profile. Then the OOD check. This is our first line of validation or and our safety layer. So we use the training stats to flag any feature sitting more or three or more standard deviation from our mean, right? And then once that validation is done, step three, move into the core workflow, running the model to generate that risk score and probability that you see on the pipeline output on the screen. And then once we have that, we compute the sharp values to rank the top features. So we know exactly why a risk is being flagged. And for the high risk users, we run those counterfactual simulations. So we essentially ask, what if we flip this feature like smoking to zero and re-predict? This gives us the what could be for that specific patient, right? Then finally, we intelligently dispatch to our specialized agents. So in this case, if we look at a patient with a risk score of 0.85, in a traditional system, that number might cause panic without a plan, right? But with this system, what we're doing is because the orchestrator knows why the score is high, our sharp analysis immediately identifies the core causes. For example, high blood pressure and smoking, and then dispatches the case specifically to those agents. So that would be the hypertension and smoking agent who would curate that personalized plan to mitigate those specific risks. So what the caller would receive back is a clean, actionable response with the prediction, the probability, and the curated mitigation plan. So these are the seven specialized stateless agents. So these agents are designed to be, like I mentioned, they're stateless, but they also context aware. So they aren't just firing off generic advice. They are triggered by specific conditions within the user profile. So that would be the risk factors. So, for example, a blood pressure agent, they are activated if the systolic or diastolic readings are high. The diet agent steps in when cholesterol or glucose is elevated. And then we have the exercise, smoking, and alcohol agents, which is triggered by lifestyle habits. Now, each of these agents implement a get recommendation method, as you'd see on the screen. And it takes the raw user data and an optional sharp slice, and that is for the specific feature contribution for that domain. So this means that the agent isn't just seeing this patient has high blood pressure, what it sees is how that BP actually contributes to the overall risk. So with this system, it's explainable, but what I like most about it is the extensibility. In a region like the Caribbean that is diverse, healthcare needs that flexibility. So if we want to add a new risk domain tomorrow, we simply build a new agent and register it within the orchestrator. And with that, we built a system that is scalable as it is precise. So another key differentiator in this orchestrator is, or this architecture is how we use our LLMs. So our agent don't rely on static one-size-fit-all templates. Instead, they engage with our dynamic prompt construction. So we are utilizing a single shared Google Generative AI SDK client, and it's initialized in the orchestrator class and passed to every agent. So this keeps our system resource efficient and of course fast. But the real power is in the prompt itself as it's evidence linked. So we tell the LLM that smoking increased this patient risk by 0.15, allowing our LLM to generate advice that is grounded in actual mathematical drivers for that patient health. Of course, the healthcare provider will vet this before it goes to a patient. So to move from a black box to a clinical partner, we integrated three distinct XAI layers into the architecture. So I would have mentioned these before, but to go a little bit deeper, we're using the sharp for our why, we're using the counterfactual for our how, and then confidence is that certainty. So with the sharp, we see that at that level, we calculate the local feature contribution at the moment of inference. So the orchestrator identifies the top five drivers and passes them to our LLM. And then with the counterfactuals, as I described earlier, here is where we simulate that intervention. So that turns data into a roadmap for change. And then with the confidence, here's where we measure the model's distance from the zero point 0.5 decision boundary that we would have set. And because we're building for a critical healthcare environment, we built it with resilience. So if the API ever fails, the system automatically falls back to a keyword-based canned response. And we ensure that no matter what, the clinician receives sensible and actionable response. Or if the system doesn't know an answer, it simply would respond or give a message of uncertainty should the need arise. So when evaluating our system, we have to look beyond raw accuracy. While we report an accuracy of approximately 88%, you'll see that in the graphs on the screen, right? While we report 88% accuracy, which is consistent with the benchmark of this dataset, our true focus is on agentic design and clinical explainability. As we expand our dataset beyond Kaggle, or as we move towards expanding our dataset beyond Kaggle to include more diverse localized clinical data, increasing that accuracy will be our primary engineering objective. But in healthcare, a model that is biased is a liability. So we prioritize equity as the primary metrics for this model, right? Not just accuracy. And we audited our model for gender bias, as I mentioned earlier, ensuring that our demographic parity difference remain under that 0.05 in absolute value. So we are closely monitoring equal opportunity differences to ensure that our recall doesn't unfairly favor one group over another. And our strategy, of course, is transparent, actionable, and equitable for the Caribbean. So, by moving beyond static insights and into the realm of proactive agentic support, we are empowering cardiologists to focus on what matters most by providing the tools to turn that data into immediate life-saving intervention. So, my vision is to make care accessible, ensuring that every citizen can benefit from the predictive and preventative power of technology. And for our next steps, I'll be optimizing the model on larger, more diverse data sets. Of course, I'll be publishing our findings to academic journals along with my team and moving into the MVP and piloting phase. So if anyone is interested in collaborating or have questions about these milestones or the project, feel free to reach out to me. My contact is on the screen. And thank you so much for sharing your morning with me.
Okay. Okay, great. So thank you very much, Tamika, for that amazing presentation and really giving us quite a extensive background in terms of how to use agentic AI for cardiovascular disease in Trinidad. Is very a really nice scalable and replicable solution as far as I see. So I
Mhm.
know a lot of the persons who would be watching would want to know, and I know you gave a really personal context initially about wanting to be a cardiologist and then getting into the data space and feeling like you're still fulfilling that aspect of things, being able to give, the recommended advice based on the data. But in terms of your personal background, like your academic background and what you have done so far in terms of your experience, could you tell us a little bit more about yourself in that regard?
Sure. So while my title says Senior Product Manager and AI Engineer, if you look at the why behind my work, all of it, you'll see that at the core, I am a simple healer and a teacher who uses technology as an enabler. So everything I build is a reflection of those two identities. So my path didn't start in a specific industry. It actually started in my childhood, that instinct to protect and empower. So long before I was building algorithms, I was driven by the need to mend what was broken and share knowledge with those around me. So I was always teaching and learning. I remember beating my step with my little ruler teaching, as well as, of course, healing. I really liked to heal, even if it's through mental health. So that innate drive has been the passion with every stage in my career. And then right now I'm in education technologies, and I found that it gives me a platform to really teach and help people in that regard, shaping those minds with the career paths that they have to learn and the things that they need to learn to become that best version of themselves. So building systems that empower the next generation with the tools to navigate this challenging and ever-changing world. So at the heart of everything that I do is really that core, healing and teaching. So my heart has always been pulled towards education and healthcare.
Nice, nice. And that is
Yeah,
really very, very admirable because I
yeah,
think that especially now, and you're really going into the motivation, which is really
yeah,
understanding, the why
yeah.
of, what made you do this project. So in terms of that, the healing and the motivation behind
Mhm.
it, I would have recognized you had to build a really amazing and advanced skill set. I don't know if you want to kind of share with the audience in terms of the resources and maybe training or
Mhm.
anything that you would have used to help you to really build out this project in terms of what it is now.
Yeah, so that's a great question. So it started with data. I knew that I wanted to build this cardiovascular disease detection project. And this actually started in my undergrad, and that is where I found the data set. It's actually through one of the WIDS workshop that I attended and was introduced to Kaggle. So I went and I looked for this data set in Kaggle and I found it. And I was like, this is really cool. So me and some of my colleagues, we built this system from a predictive level. And now that I started learning about agentic AI through TT Lab and also through my work progress there and what I do there, we had to build a lot of agentic systems, right? So what I started to do is I started YouTubing and also attending some of the workshops. But YouTube really helped me. And what I did with that Kaggle data set, I started implementing the explainability portion to it. Then I started implementing the agentic work. So it's really a lot of YouTube, a lot of researching, and honestly, Professor Patrick Hussein actually guided me along the way as well. And one of my best friends in TT Lab, Abdullah Ali, he also introduced me to agentic work. So it's really
Right.
networking and learning as I go along.
Yeah, yeah, and that is amazing. And of course, TT Lab is quite a great partner of ours, and we're really happy
Yeah,
to have Prof as that inspiration as well. And happy
yeah,
that you're able to learn from the WITS workshops also,
yeah,
especially in terms
yeah.
of the agentic aspects, and of course building
Mhm.
the Kaggle aspects in terms of building the data set and using that.
Yeah,
But I mean, everything that you've said now, it really speaks to, having that motivation, as you said,
yeah.
understanding how to work in like, the community aspect of things. So
Mhm.
basically, what would you say your advice would be for others who want to get into the tech space or do similar projects? What would your advice be at this point for them to be able to be, motivated to do that?
Yeah, so I'll give three advice. And the first thing is don't wait until you're ready. Often we will try to wait until we master a specific skill, then
Mhm.
to implement something. If you have a drive and you have an idea, start building, learn as you go along. And then the second advice that I would give is look around you. There's always a gap to be filled or a problem to be solved. You don't need to solve or build the next big thing, just solve one problem and keep appending on that. And you'd be amazed to see the start and the end product is really amazing. It's a lovely journey. And then the third thing is don't build in isolation, like seek out community engagement, seek out help, ask questions. So build with your community and you'll see that you're building yourself.
Oh, that's
as you go along.
excellent. I could not have said it better myself. Excellent advice, Tamika. I'm really, really happy to have you present on that today. And of course, our viewers would want to hear more about you. So we'll provide some of the links in terms of your LinkedIn and contacts in the
Yeah.
description. And thank you so much for your time and being able to share this with our community. And we thank everyone for joining us. Please continue to join us for our Spotlight Talks on YouTube and subscribe for more. And we will see you in the next one. Thank you and take care.